Till the time Rusty settles down, there was one person who had inquired about some exercises for the hip. So he said that he
Okay.
was having problems in the hip since very long time, and has been doing have been doing some exercises, but it's not helping him. But so, is it MS related, or is it something to do with the seating position?
Yes.
Yeah,
It's better if it's in here.
Yeah, Rusty, we can hear you. I think you're getting late network.
Yes, I can hear in here. Yes, I can hear.
Do you have a question to ask?
Yes, I have a question.
Go ahead.
I have a question. So, what the best practice in for my daily activity, for my daily in this situation in what is it? Pandemic, in the pandemic is the COVID corona. So what must I do in home to practice and exercise to what is it? To what actually my condition is I use walker or cane to help me to walk. Okay, then I want to stay off from walker. So what is the best? What is the best practice in home?
Yeah, so there were a couple of videos that we posted in the last 2 weeks on Mondays where they showed about exercises each. So really the best things to focus on are your quads and your glutes and your pelvis, because that's what's going to keep you upright, as well as the ankle. And what we've really been discussing is really try to get into a routine where you're doing something every day. You're starting off nice and gentle, and then you progress as you're able to, increase your resistance. We posted a few workouts where you don't need any equipment whatsoever. Simple things just like standing up from the chair without your arms, laying on your back and doing some bridging. Bridging are really good because it's going to help with the glutes, but even some wall squats as well. So, there are a couple of videos. I would refer back to the Instagram page and check them out, because we did them back-to-back weeks, and every Monday we're going to be posting new exercises.
So Rusty, I'm going to share you the link of all the exercises, yeah? The doctor has recommended for condition.
So, what is it? How much time in a day I must to exercise, doctor?
Yeah, so if you're not currently exercising, then I would start off, just try everything that you see, just try one round of it. So if you see an exercise, try like 10 to 15 times of it, and try like 4 to 6 workouts that first day. See how your body responds. If your body responds really good and you feel good, then increase the time little by little. So if the first day you do like 10 reps or 15 reps and only one time, then the next day try like 2 rounds. The week after try 3 rounds. But everyone is different. Sometimes people can exercise for 2-3 hours. They can go on a walk, go on a hike and feel good, or sometimes they can really just do a little bit and feel tired. So you have to see how your body responds. If your body has a positive response, then try a little bit more. If your body has a negative response, that doesn't mean stop completely. That just means maybe do a little bit less, or even the same exact thing. Because individuals, not even just with MS, but everyone, is if you go back to doing something that you haven't done in a very long time, your body is going to be shocked and get very, very sore. But that's normal. So if your body can respond in like a day or 2, then that's okay. But if you do something and it's very strenuous, then I would try to lay a little bit less intense.
Okay.
Yeah, so start gentle, see how your body responds, and then increase it as you go along.
Okay, doctor. Okay, thank you.
You're welcome. And then, stay on the lookout. Every Monday, we're going to be posting videos for the next few weeks. So we're going to try to do something different. 2 weeks ago, we did an exercise session. Like, what can you do post exacerbation of symptoms? So it was very, very gentle. Then we did some foot drop workouts. So every week it's going to be something specific. So just keep an eye on it on Mondays.
Okay. Okay.
Angie was trying to say something.
What?
I think Angie was saying something.
Oh, I was actually wanted to put in my 2 cents. I belong to a group called MS Fitness Challenge, and I actually just completed my certification of becoming MS Fitness, trainer specifically for people with MS. So on this, with this charity, they offer free services of working out with multiple sclerosis for people specifically with multiple sclerosis, so that you can follow them on Instagram and then through that get linked to their page. And they have tons of online information on how to work out properly, workouts, people who are immobile, with walking aids, without. I joined it 2 years ago, and the difference with my fitness is just incredible, because I learned how to truly work out properly with someone with multiple sclerosis. Because what I was doing before, the high impact, I would be fatigued and wiped out for 2-3 days, not knowing that, the getting my core temperature way too hot would fatigue me out for 3 days. Where if I work out smart and specific to building leg muscles for drop foot, core for getting up, arms for lifting, it changed my perception on how to work out and work out properly. So they're a great group. It's free charity, and I just wanted to put it out there. And I think it aligns with what the doctor is teaching with at home, and improving our daily function through strength building. So it's all good stuff.
Thank you. Thank you. You've seen your stories. You really look fit. Okay. Okay, doctor, we have a message here from David, who has written, Doctor, I'm suffering from insomnia these days. I just can't fall asleep no matter how much I try. Sometimes I fall asleep by 5 a.m. and sometimes I can't even stay awake as long as 8 a.m. the following morning. Is there something that can help me sleep better? I already do yoga and meditate. However, it doesn't help me.
Yeah, so we discussed this last week, and some of that I recommended was you want to try to go to sleep and fall asleep really the same time every night, because if one day you're going to sleep at 9 o'clock at night, another day 1 a.m., then the next day 11:30, your body's not going to really get used to like a sleep-wake cycle. So step number one, you really want to try to go to sleep and wake up the same time each day as close as possible. Something else I recommend is you want to try not to really watch electronics or TV 2 to 3 hours before bed, because that can stimulate the brain and it's much harder to fall asleep. If you're already doing all that, then there are some essential oils that you can use, lavender, or even seeing an acupuncturist that can be very helpful for sleep cycle. I know last week we also talked about teas that someone mentioned just now. So there's a ton of things to do, but really just trying to limit brain activity prior to bed and trying to maintain a normal sleep-wake cycle.
Right, doctor. Claire has written that Violet suggested chamomile tea, which is also true. The other thing is, doctor, I'd asked you a question by one of our followers by name of Tejas691. He has asked for some hip exercises for flexibility of hip, and he's wondering if it is any way related to MS or the seating position.
Yeah, I mean, it's very hard to just answer that, because we got to know a lot more information. Like, many people have hip pain, so it's very tough without meeting someone to realize if it's from MS or not. I mean, what you can say is if the gait pattern is altered and someone has weak quads or a weak ankle, like if they have foot drop, they're going to be working a lot more on their hip flexor to compensate. So it definitely can be from MS, but without really seeing you, tough to kind of make that determination. But some, you know, really, if you just look up like some hip flexor stretching, because that's usually the muscle that gets very tight. That's what I would really take a look at. Sorry, that's my dog playing, guys.
Extremely cute.
Yeah, they're new. I didn't have them 2 weeks ago, so.
Oh, like baby.
Yeah, they're children. So, all right. So yeah, I would really look at stretching out the hip flexor. That's another thing that I can make a video on, is stretching for, you know, for MS, because the calves get very tight if there's a foot drop. The hip flexors get very tight. There could be spasticity coming from that, but really, you know, a lot of individuals have hip flexor tightness if they're sitting for a long time, if they're in the wheelchair. So laying on your stomach is a great one to stretch out the hip flexor for about 30 minutes. You can lay in your stomach. You could put like a pillow underneath the belly area and kind of go up on your elbows. That would really stretch out the front of the hips, which will feel nice.
Okay, I communicate to that person. Doctor, this one other question given by Abbas Fijun. She has been complaining about a lot of leg pain, and lately, so she's off her DMTs. Probably her doctor has suggested her to go off the DMTs, and now she's getting weaker day by day. Now she has started using cane, and she has been doing acupuncture. She feels good temporarily, but then her pain again goes back to the same way. I am not sure why her doctor has suggested her to be off the DMTs, but that's a condition is. I have already given the reference of your earlier suggested exercises to her. Is there anything more that she should see? I've also suggested her to probably see a new neurologist, maybe if she's not getting a proper guidance. The ladies from
Yeah,
Iran.
checked out by a physical therapist too, because you know, if there's having leg pain, then a PT can really try to figure out where it's coming from. But I would definitely try to accompany some sort of workouts with the acupuncture, because acupuncture is really going to work on more the muscular tissue around it, helping relax everything. So we got to be able to see like what kind of deficits are present that could be causing all of that.
All right, doctor. Okay, guys, do we have any other question coming from you?
I have a question.
Yeah.
Can I?
Of course.
Okay, I want to ask about eyes. Multiple sclerosis is affected to the eye, right?
Yes.
I mean, there is what is the best? What is it? What is the best? The best way what is to keep our eyes to what is it?
Like
To
them healthy, the eyes.
stay clear. Yes, about eyes, I think.
Yes, I would
About
definitely
eyes because
try to make sure that you have like a neuro-ophthalmologist as part of your, you know, doctors, because they can really, someone who's seen MS before, you know, because a lot of times with MS you could develop optic neuritis, and
yes,
really sure you have the appropriate doctor to kind of evaluate that. Not a general eye doctor, but really like an ophthalmologist, as they can look at the eye health.
so I mean, is that what is it? Is that vitamin or like a food to apa, to
Yeah, I mean,
to
with
save our eyes?
MS, it's really, you know, if we recommend general healthy eating. You want to avoid your own body's inflammation. So staying away from high inflammatory foods has had patients feel much, much better. The
Is
flare-ups
the
are really,
what is to see cell phone too long? Is that very effective to our eyes? Maybe to our MS optic nerves?
as far as I know, there's really, I mean, I haven't heard of use of cell phones for increasing optic neuritis. I'm not sure if someone else in the group can kind of help answer that, if what experiences they had, but you know, that's not something I evaluate. That's more like an ophthalmologist.
I think Angie had told about this last time.
Yes, I had suffered from optic neuritis, and during the time where the vision was lost, it was minimal computer, minimal cell phone use, only because it put too much strain on my one eye, and I did get on higher doses of omegas, folate, E's, and C vitamins. Kind of bumped everything up a bit, but I've kept maintaining that. But with what you're saying with cell phone use, what also is a problem is you're looking down on your cell phone. You're looking down on your computer. You're looking down, which is here, which is causing strain actually in your neck, which a chiropractor and acupuncturist, you know, would help with along that, as well as the exercises that the doctor maybe could help with, you know, stretching, bring our neck, you know, curve it the other way. So that's kind of, but supplements along, if you look up, you could Google eye supplements and then look at that and see what supplements you're taking, if there's enough, and maybe bump it up a little bit.
Have
So
you
we
heard
can do stretching, right?
prevent it?
No, you can't prevent it.
Yeah.
It's where it's just where a plaque or a lesion will show up. It's not preventable, but you can, you know, be kinder to your eyes. So
Every symptom
with
is
what
like a
you were
surprise to everyone.
with the cell phones, you want to make sure that you actually, this is funny because this just came in the mail for me yesterday, International Journal of MS. I didn't put it there on purpose, but you want to make sure that you aren't looking down like this, because that is going to hurt the neck, give headaches. You always want to make sure that everything's kind of above you, so you're looking straight ahead, because the more, you know, people are on their phones or magazines like this, and that definitely will increase ocular pain and all that.
Okay.
Okay, I see there's one question again by David here, and he has written that he has been having a lot of backache lately. So I believe for MS Mondays, doctor will be sharing some exercises for the backache. So that can be addressed in that. Yeah. Okay. Are we having any other questions? Oh, pardon, sorry, doctor.
Yeah, I'm going to show a couple of core exercises and a couple of stretching, but you know, really the main thing is we want to figure out why is that back pain occurring. So with my patients, I always look at their balance and what is happening when they lose their balance. And many times when they lose their balance, they're just kind of extending backwards, and that's causing a lot of compression. So that's when we really want to have strong core and strong ankles to make sure that our spine doesn't really go backwards. Because that will cause a lot of compression. Same thing, if we have weak quads, we're not going to really be able to bend down appropriately to pick something up. So we have to make sure we strengthen our quads so we can bend our knees to pick something up.
Okay, so I think it clears your doubt, David.
Yeah, it pretty much does. I just have one follow-up. So, doctor, lately I've been having a lot of stiff back as well as my neck. I asked you this question like about 2 weeks ago, that when I cracked my neck, I felt like a current along my right arm. So it happened to me again yesterday when I cracked my neck slightly, and I felt a current along both my left as well as my right arm. And of course, my neck and my back is almost always very stiff. So I'm not sure what's going on. Is there something serious or not?
Yeah, so I mean, what you could be doing, like there could be just like a nerve adhesion, because the nerves from the neck supply arms. So if there's that's bundled up and you're kind of cracking it and you feel that quick current, it could just be that you're irritating the nerve. Really want to try to do some like neck strengthening exercises. So you can, you know, because you have a stiff neck and you always feel like you have to crack it, that just means it's very unstable. So some general like neck workouts you can do. If you have a ball at home, or even use your hand, just have your hand on one side, push your head into your hand for about 6 seconds from the side, straight back, and from, so pushing your neck into your hand, 6-second holds. I would do about 10 reps each side. That'll strengthen the neck, or you can lay on your back or your stomach and just practice on lifting your head gently off of the position, because that'll tighten up the muscles in the front as well as the back. So if you're laying down, kind of lift your head up, hold it there. You're going to feel contractions through here. But I would start with the seated exercises and really try to avoid doing self-manipulation. You don't want to kind of just crack your neck, because you'll get that. You want to avoid that current. If you're creating that current on your arms, so that means you're probably doing something that's irritating those nerves. So I would just try to stop that.
All right. Thank you so much, doctor.
Yeah, but try these workouts. So you're up tall, hand is here. It's really gentle, and you're just bringing your head, holding for about 6 seconds. You're going to feel it on the right side. Relax. So I would run through 10 reps this way. And you'll use your other hand, push straight in. You're going to feel it on the left side. Relax. And then from the back, hand is here. I think you could see me. And then you're just bring your head straight in. Same thing. Hold for 6 seconds. Then you're going to feel in this part of the neck.
All right. Thank you. Gotcha.
All right. But yeah, just really try to avoid doing self-manipulation to the neck.
Okay. Thank you.
Angie.
I know when I feel the stiffness in my spine or in like different areas, I'm either super dehydrated, and then I got to bump up my hydration and get that suppleness back in my discs. So sometimes with the change of the seasons, we don't keep up with our water, or we're depleting more heat. We may have to bump up our water, and also our oils, flaxseed, chia seed. We need more oil, more lubrication of our spine. So that's where omegas come in. I believe, there's a lot of healing with good supplements. So
Thank you. There's one more question, Doctor, that I have with me here from Sizzle, and she has written that she is complaining a lot of burning feet. She feels that her feet becomes hot. It's like burning.
Okay.
So what is a remedy or a cause for it, firstly, she's asked?
Yeah, so a lot of my patients, I think we discussed this in the very first call, is that if we have numbness or pain in the feet, a lot of times it could be coming from the back itself, so the lumbar spine. So really what we want to try to do is avoid things that are going to compress the back. A sciatic nerve glide is something that we showed where, we're laying on our back, one leg is kind of bent,
Yes.
and we're pumping the foot up and down 10 times. If you start feeling increasing burning through here, that means that's that nerve that's causing it, because your sciatic nerve runs all the way from the back of the leg, splits into two, and then goes to the bottom of the foot. So I would definitely try to do some of those nerve tension glides, figure out where is it coming from. It could also be coming from your hip, because that nerve runs through the hip. But if whatever we're doing, nobody can really figure out where's that burning coming from, I would get a nerve test, because a nerve test can tell you if it's coming from the spine. Burning feet can come just from, inadequate blood flow. So you can always get a vascular examination. It could just be coming from compression. So, that would really be something you would need to see like a foot doctor. But, it could be coming from so many different areas. I would try it with that nerve tension glide that I first showed.
Yeah.
You could also take like a cold water bottle and just rub your foot back and forth on it for a few minutes, because that'll help break up any tension on the bottom of the foot. Plus ice itself will help reduce nerve tension.
Yeah.
So I hope that helps.
Yes, but this burning sensation is actually a part of MS also, because I think I have also felt a lot in my hands, in my palms, as well as on my feet. So it's quite relatable that ways. Yeah.
Yeah, 100%. I mean, it definitely can be something internal. And that's, that's why like some of these general questions, it's really, we got to be able to see someone, really finding somebody near you that can focus on the MS and all of your symptoms, not just a neurologist, say that everything you're feeling is because of MS, because that's not accurate. A lot of these things happen to individuals without MS. We blame it on the condition we're diagnosed with. So it's really important to find somebody well versed in the whole body, pinpoint where the specific symptoms come from.
Right, right. Okay. Fine. I think there's one person who just left and went. Do we have any other questions here by all the people that we have already in the group just now? Okay, so we're going to keep the session short today, and we'll see when to do the session next. Dr. Zolo has some appointment today. Diane, do you have any question? You are here for the first time. I'm not sure if she's able to understand. She's from Indonesia.
Diane is my friend.
Oh, okay, okay. Okay. She has been communicating a lot with me, so I know her. Okay. All right. Do we have any questions? Otherwise, we'll have to end it today for today.
None for me. I've got none. I'm still trotting. I'm not getting so much pain in my neck. But Dr. Zolo, I'm not doing sport mode. I am pacing because I've slowed down my walking and it's working much better for me.
Great to hear.
Thank you.
Yeah,
Right.
so look for our videos on Monday. We'll be posting some content. So tomorrow we'll talk about the low back a little bit, and then after that, if you guys want to something else to come up with the after, just keep me posted what you think will be beneficial.
Dr. B, have a last question from Diane, Resi's friend. She has written, Doctor, I have a problem with my left finger, feet 1 year ago. I like walk, but I want to run or jump. What's exercise can you say? So she has finger on in a toe, I believe, specifically.
Yeah.
Yeah.
Very tough question. I mean, I can't, I really, it's very tough to answer something like that because I don't see how this, how this individual presents. Exercises for running. It's just, we gotta strengthen first. I would really try in the pool, try some running in the pool, see how that goes. It's all about full body strength. We gotta have strong quads. We have to have strong hip flexors. We have to have strong ankles. Doing a full body approach is what's most important. Making sure we're pacing ourselves. But I would really try doing some stuff in a pool to kind of help with the endurance.
Right. Okay. Okay, doctor, then we do not have much questions today. So we can probably catch up the next time. I'll first invite more questions from everybody. If we have, then we can do the session. Otherwise, we can do it alternatively, whatever suits you and everybody the best.